we talked a little bit just before you hopped on with Elizabeth, and the reason that we're obviously having this is so that you feel equipped to be a tutor for some of the different things that you're going to come across. But we also want to make sure that what we talk about today meets the specific needs you have and why you joined us today. So a lot of information in this presentation. But if at any point you have questions, this is very casual. So just stop me, flag, wave me down, and we'll just chat about it. So I'll just tell you a teeny bit about myself so you can understand how I got involved. But I am a nurse, and I've worked at St. Luke's Hospital for 16 years. Gotta think, 16 years, and that as a nurse, and that doesn't include the 2 years that I worked there when I was in nursing school. So been at the hospital for a long time and interacted with the limited English population in the middle of all that, and loved what I did, and always felt like I wanted to do some sort of international or global nursing, but never had the opportunity until the last couple of years. I started back to school for my master's in community and public health. And at that point, just so thankfully ran into the Catherine McAuley Center and decided that I would love to pour some time into that population. So spring of 2019, I started as the fancy title of Refugee and Immigrant Healthcare Navigator, which is a great acronym that you can't pronounce, but fancy title for helping immigrants and refugees connect with the healthcare that they need, because we'll talk about this a little bit. So often they don't understand what they need, or they don't understand our system, but I wanted to be able to set them up for success. So that's kind of me. And my role wasn't really even defined. That we came up with my role and a job title. And sometimes I look back at my job description, my initial job description, and I'm like, oh, this season I've been doing this. And then this season I'm doing this, with the crazy year that we had. So that's a little bit about me, and thanks for joining us. We'll just jump in. So some of the things that we are going to talk about today is we want to make sure that you have an understanding about what we call reception and placement. We're going to talk about specific cultural issues, some of them by their nationality. We'll talk about the things that they struggle with, their health needs, and also a bit about their perception of healthcare. Some of the problems that we do commonly see among the refugees and immigrants is mental health and women's health. We'll talk a little bit about that. And then also giving you some tips on how you can interact if that starts to come up in a conversation, as well as some resources that you have. We'll give you resources so that you know where to go when you're coming across those things. So this is basically just looks like a very confusing and complicated slide, and it really is a good example of what we have to do in the first 90 days. So if you do ever take the tutor session, I think that Sarah Zainich does, about what it means to be a refugee and what that entails and what our part is as Catherine McAuley Center. But when we get a new refugee in our country, we have sometimes maybe a month or 3 weeks that we know this specific family is coming, and we have to start getting ready because we have 90 days to do all of these things that you can see here. If they have kids, we have to get them in school. We help them find a job. We help them get bank accounts and Social Security and Medicaid, and also just want to kind of immerse them in our culture and give them a quick kind of very broad overview of the our country and the cultural orientation to our country. So the big piece that I help with is when we have these new arrivals, to help set up their healthcare process. And what that entails is, before they come, they have been identified as what I call case A or case B clients, depending on if they have healthcare needs. So if we have a class B, then their healthcare needs are going to be a bit more intensive. And you can pop to that next slide. That'd be great. Thank you. Do you feel like Vanna? Yeah, a little bit. Okay, great. So when we have we have pre-identified them as having some significant healthcare needs. We want to be ready to address that before they come. So before they come to our country, this has been identified, and then we are set up to help them a little bit more efficiently. If they are sick, even if it's not even, but with conditions such as diabetes, high blood pressure, or even more chronic conditions, heart disease, lung disease, or some of them can come with some blood diseases like anemia, problems with their spleen. So if there's any concern that they might be a little unstable, I try to meet them at the airport with a case manager that's going to be taking care of their case, just to get that first look at them, make sure they look okay, and ensure that they don't need to just hop right to the hospital. Haven't had to do that yet. Most of them have come and looked great. But then we want to get them into our healthcare system. And at this point, we do two major appointments for them. The first one is with Lynn County Public Health, where they are assessed for their vaccination status, make sure they have everything they need there. And then we plug them into a provider, and we exclusively have used Eastern Iowa Health Center because they work great with us. They have a great understanding of this population, and so they're so supportive of that. So plug them into Eastern Iowa, get them their first like establishing primary care there. And then we also work really closely with Reitzel Pharmacy. Reitzel Pharmacy has done such a great work over the last couple of years with me. They not only have an automatic delivery service where they would deliver medications to their home, but they have either of you heard of an application? It's called WhatsApp. Are you familiar with that platform a little bit? So the great thing about WhatsApp is it doesn't use data. And so we've found that a lot of our population will use this to communicate with one another. Well, Reitzel kind of jumped on that, and because they're a small business, they were able to get permission to use this to communicate with the clients. And so they will send them a text message in their language saying, we're coming to drop off your medications. Will you be available? And then they can text back the answers in Reitzel. We've helped them with a little cheat sheet so they can understand. Or every once in a while, I'll get this email or a phone call. I have no idea what this means. Can you tell me what this means? And I'm like, I don't know either. Let me grab my interpreter. And then so there's this great, really fluid distribution of their medications, as well as Reitzel has med packs that they've made up. And I wish I should have thought to have one to show you, but they're like those little daily packets of their medications. I'm sure you've seen those, but on the actual packet, it in their own language, it says when they're supposed to take it. And then I love this part. They have an icon on it to show if it's morning, noon, or night. So if some of the clients are illiterate, then they can still stay on track, and it has the date on it. I mean, I feel like this work that they've done could be like pushed out nationally and be very successful with these arrivals. So get a little.
I'm ready to transfer everything to Reitzel Pharmacy for my care at this point. And I do think there's definitely ways that we should talk to them about getting it out to more people. My gosh, I had no idea. That's amazing.
I know, they get it. They understand the barriers and how to help them succeed, which I'm so impressed with them.
Bonnie, let's talk more about getting their services.
Yeah.
That's amazing. Okay. I'll go to the next slide. I'm just so excited about that.
Put a note about that, because sometimes we get together and we're like, what were we going to talk about again?
Yeah, I will write a note.
Awesome. Okay, moving on. I think we're only on the third slide and I'm talking way too much. I just get passionate about that. So some of the concerns that actually, I think I bumped this slide out of order. Maybe not. We'll see. Some of the concerns that we want to make sure that we are helping our tutors be available or aware of is that a lot of them come with mental health issues. They come with the women's health issues as well as some nutritional issues. Have either of you noticed any other health problems that you've come across or concerns that your clients have had or that you feel like would be helpful to address?
I would say certainly from a mental health perspective, some discouragement, possible depression.
Mm-hmm.
And I've been concerned and felt helpless about that, other than being a sympathetic listening ear.
Yep. I'm sure that's difficult.
Which, coming to a new country, knowing nobody, leaving your family behind,
Yep.
I can't imagine the courage required.
Oh, I know.
Learning the language, it's daunting.
They're just so brave. So
Judy,
incredible.
did you have something you were gonna mention?
The main problem I had was when a student was trying to explain to me that she was anemic and she kept using all these words, and as a student that didn't have hardly any language. And I was so thankful that one of your staff members was washing dishes in the kitchen where I was with her, and she said, "Oh, I think she has." Oh, thank you. Okay. And it just, I have to think so divergently sometimes to try to figure out, okay, what is it that this person is trying to tell me?
Yeah. Yep.
I will say that one of the things that was really surprising to me is that we had a student come in, and he was a Muslim man, and he had to have he was working at Unity Point, and he had to have a physical, and was shocked at the way that the doctor wanted to
Yeah.
do, hernia screenings. And I mean, he was like, what was that? And thank goodness he had a male doctor, because he was like, if that had been a woman, I don't know what I would have done. And
Yeah.
that he just didn't have a clue. So yeah, things like that happen quite a bit.
I know. Yep. That's true.
I wanted to say too how thankful I am for the support system that we do have in place already. Because
Mhm.
my other student, when I talked to her, I visited with her about a month ago, took her care package at Christmas, and she's looking at 2 surgeries, and yeah, she definitely needs some help.
Mhm.
And she was going to skip an appointment because I hadn't fixed her yet anyway, so why go when they're going to just bill me $99,000 and I don't have that money? And she's just panicked, and knowing that there's support system around that can kind of talk her down and help her, I'm really grateful for that, because I could just say, no, you need to go, but I'm not the person that can, have any authority other than be her friend and support what I'm hearing that her caseworker and other people want to tell her to do.
Yeah.
Help her with.
Yep. And I think that's why we see the teachers as so crucial, because
Mhm.
you are having those face-to-face conversations with Anne, how many numbers is it? How many students do you have?
Last year it was 485
Yeah.
students. So.
There's no way our staff could reach this many people. So
Yep.
giving you tools to where you come across, oh, this person has a healthcare need, this is how I can plug them in, or they have a housing need or a job need, just to be aware of what other services we can offer as staff, and you find those people that need just a little assistance. We would love to have those referrals, and I'll mention how to get a hold of us that way too as well. So thank you. That was great, you guys. Two different types of barriers I was going to touch on. There's lots of barriers to them accessing healthcare and being successful with their health. Some of them are practical, some of them are cultural. I would say the more practical ones, obviously, is the language. That just from the gate just makes it so difficult for them to, like you express, Judy, be able to speak about what's going on if they have to use their own language and they aren't provided with interpretation. Also, we found transportation is a huge barrier to them being compliant with appointments and even getting medications. That's why I love Reitzel, because they don't have to go pick up their meds. Just shows up on their doorstep, and like refills just automatically go. So transportation has been a big issue that we're working with, and we do what's called bus orientation when we have new arrivals, so that they can understand the bus system. First day we get on the bus with, I say we, I haven't done this yet, I'm supposed to, just so I can understand myself and be able to be a resource if needed. But our staff get on the bus with them and ride from the bus to the Catherine McAuley Center. We'll have whatever session or whatever we're doing that day, and then get back on the bus, ride home with them. And then a second time, we'll, if we feel like they're really struggling, we'll meet them at the bus stop, and then we'll get them on the bus and we'll say, we'll see you there. And we jet in our cars and we meet them at the other end, so that they have confidence that, okay, this really works. And if we can give them that tool, then so many other things can change for them, not just their healthcare, but so many other things. So transportation definitely is an issue. Like you mentioned, Judy, the cost, if they don't have insurance that they need, or maybe they don't know they qualify for Medicaid. So the cost can also be a barrier to them getting their health care. Work schedules are also difficult. I would say when a family comes here, they put work as almost the number one priority, because to them, they are so excited to be in a place where they can provide for their family again, and where they can work, and they feel like money, and understandably, money is going to be what helps them to be successful. So they want to jump into those jobs. They don't want to miss jobs for healthcare appointments. So we have an employment services, and she works with employers in the community and talks to them about when they need to be off for their appointments. And you have this great window that just popped up. Let's see. This is great. Let's read all of Anne's emails.
Oh, I
Is
have
that
a
you?
window that popped up.
Oh, no, it's because it was mine. That's
Oh, okay.
great.
I was like, what happened? I have a window. Okay.
I'm
We'll
glad
come
that
back.
it was mine, and you guys, no, I'm just kidding. I don't know how this happened, but whenever I get an email from anywhere in Catherine McAuley and I'm on my personal computer, it just pops up and takes over my whole screen. So
Oh,
probably
I can
a
help
good
you with
feature.
that.
Oh, thank you. Anyways, so that they miss appointments because of work. So we're working with the employers to help them understand that they need work notes, and that the first couple months they're there, they will probably need to miss sometimes for appointments. And also just communicating that back to the refugees, that it's okay to miss work. You're not going to lose your job. So a lot of times, if they don't come through our program and they come here through different means, if they're maybe immigrants or asylum seekers, we might not have all their immunization records and their medical records. And then culturally, and this is a huge, something that even though we're going to talk a little bit about it today, that for us to feel like we can understand their cultural concept of healthcare is silly that we would understand, because ours is all, every individual in this country has a very unique perception of it. And so that is definitely a difficult barrier to overcome. And then also, I just talk about our healthcare system is so unique to some of the systems that they've come through. It changes all the time depending on our administration. And then also, prevention is a huge piece of our healthcare.
Oh, I didn't, sorry. This was all on here and I didn't know it.
Oh,
Sorry.
I should also be kind of probably.
Yeah, we weren't paying attention, ladies. That's the truth.
Presented information. You guys are like, oh my gosh, she's talking a lot. But prevention is a huge part of our healthcare system, and they don't necessarily grasp that concept. And I've heard them say many times, I feel fine. Why would I go to the doctor? Or I'm working with an individual right now that needs a procedure to correct something in his heart, and he says, but I feel fine, my heart's fine, I don't need to have this done. And despite the fact that all the tests that we've had and all the things that we've done for him to show that if he does not correct this, that difficult things will happen, he does not want to do that. And that's another great thing about this country, is you can choose what you want to do. And so even in that, being like, okay, I'm gonna let you choose. I can't make you do anything. I can give you knowledge and let you make that informed decision, which is a little bit why I wanted to mention health literacy. The U.S. Department of Health and Human Services defines that as the ability to understand health information and make autonomous decisions. And that's what we've really done with this particular family. We've gone above and beyond to make sure we want you to understand the two courses that you're choosing so you can make your decision. And they did. And then I found a study that supported the fact that if individuals have limited English and they also have low health literacy, they don't understand our system, they can't make those decisions, that they have health issues twice as often as somebody that has good health literacy and that speaks English. So that's kind of a big red flag to me, that they're going to have a lot of health problems because of the language barrier. So we have about 3 slides that go over the different countries and some of their perception of healthcare. Probably won't spend a ton of time on these slides, but just that you can have these as resources. You can see the Congolese have, I think all of them actually have mental health issues on their slides, but also malaria and parasitic infections, The Congolese actually have a lot of them have very strong faith, and so when I have had interactions with them, oftentimes they're like, well, I don't, if I do have this issue, I feel like God's going to heal me. God's going to help me with that. So they have a strong element of faith that they bring to their perception of healthcare. But generally, they are pretty receptive to what we have to offer. Vietnamese, a lot of them come with malnutrition. Their oral health is an issue that needs to be addressed. And they also come with a lot of traditional practices, but they're not against the health medicine, Western health medicine, but they do come with a little bit of their own way that they want to receive treatment. So something to think about if you're with somebody from Vietnam. And then we have the Burundis and the Rwandese, which also are considered from Africa, and the Bhutanese. And they have similar issues that the Congolese have too, is just those mental health problems because a lot of the trauma that they've experienced going through their journeys to get here. And then the Bhutanese will have anemia and that B12 deficiency because of the food scarcity that they've experienced. And similar to the other slides, that they are a bit more receptive to the Western healthcare. But the Bhutanese, from what we have found, tend to seek maybe some more home remedies than some of the other cultures do. There's a great little map there. I appreciated that map. It helped me to kind of, okay.
Most people don't know where Bhutan is, so I thought I'd put
great.
a little map in there.
No, that's really great.
Yeah.
I need to have a better understanding of geography. All right, and then Elizabeth, I believe you have somebody from Puerto Rico, correct?
Yeah.
Yes. And again, like you mentioned, we didn't put this on here, but definitely some mental health issues, I'm sure, depending on what her journey was to come here. But a lot of diabetics, come across a lot of diabetics in that culture. And I have also seen a lot of Latinos with high blood pressure as well. That's something pretty common. Occupational injuries, that's a good one too, because they are such hard workers and they put themselves in jobs where they have very manual labor. So a lot of occupational injuries as well. I liked how they have a more holistic view on health. I've seen some of that as well, just in combining the faith with their medicine. And then Sudanese, yellow fever, malaria, and then diabetes for them as well. I thought this was an interesting statement. Meds will be prescribed with every doctor visit. So they feel like, oh, I need a medication, something's wrong. Why aren't you giving me medication? So that might be something that you could come across. And I think in general, some of these cultures, like the Sudanese, that women are obviously very private, and so that they would prefer to be with a female doctor whenever possible.
And it's a majority Muslim country, so there's
Yeah.
there's that too, religious. And I wanted to mention, because I came across this when I was looking up some of the things for the Sudanese population, because we do have quite a few of them. That and the same with Somalian women. You may come across or have conversations about female genital mutilation, because it is very common in both of those countries, and I'm sure many more in African nations. So I've had that conversation with a couple of students, and it's hard, and it causes some depression on your part, just even hearing that story. So just be aware of it.
And do you have any pointers on how to?
With any of these things, trauma, you just listen, because there's nothing else you can do. I mean, offering a listening ear, and not offering solutions to the problem. It's not your role to do that. So they felt comfortable enough to have that conversation with you. So, empathizing and just being there is really all you can do. I was just listening, really. And then, how to make you feel. Are you okay now? Do you feel like you need any help with any? I mean, that's just what we did. And it was fine conversations, but you just bear witness at that point. So
That's really good. I think there's a tendency probably to feel like I need to fix this. I need to have answers for you.
Mhm.
when really maybe just part of it is they just need to talk.
Yep.
Let it go.
Yep.
Which is a great segue to the mental health little information we're going to give you. We've already talked that a lot of the students and the clients that I work with struggle with mental health problems. A lot of depression, like you said, Elizabeth, and then even that PTSD. And also, I don't feel like at least from here in our community, we're the greatest at addressing those PTSD issues with the refugee and immigrant population. And I think some of that is because we don't have enough ethnicity in our healthcare profession. That if we had individuals that had come from that background and that were now in mental health, I mean, they could offer so much more just with the empathy that they have and knowing what these individuals would need. So I think some of the work that I'm doing now is we're trying to support individuals that want to go into healthcare so that we can have more of that support of people. Yeah, so the treatment, it sometimes is effective, sometimes not. Sometimes they need medications, but it's some. I think we could do a lot better, even with the clients that we have coming through. The screening that they get at their primary health providers is developed for the Caucasians in our country, basically, and it's not developed for these individuals. I will mention that there is a great work that's coming out of the University of Iowa. It's called PM Plus. It's called Program Management Plus, and it is done by this brilliant man that has spent all this time in other cultures and countries and really gotten to the core of how to address mental health issues that is on a smaller scale before somebody gets to the point where they're suicidal. How can people of ethnicity and that don't speak our language, how can we address their issues? And he came up with a program where they train people from within someone's own population that is stable and doing well. And then these people will go out and have smaller sessions with individuals in their own circle of friends. And it's very structured. A lot of it's based on stories, like they'll have a story about an individual that is struggling with this, and then it opens a door for people to talk about it, and then it leads them to, okay, if you've ever felt like this, what have you done, and you could do this. And so it's pretty casual. It's in the homes, and I think it's a great program. And I'm sad because of 2020, they were just getting it off the ground and they never got to the point of having some sessions. They've tried to do it virtually. I don't know how successful that's been, but really, really good program that if this ever does get up and running, that we will pass that information on to the tutors so that if you do come across somebody that you feel like could benefit from it, we would be happy to give you that info. We will move on to PTSD and depression. These are some of the signs and symptoms. Sometimes there will show symptoms of withdrawal, trouble concentrating, which as tutors, if you recognize that piece, I don't know if part of your training is that if you're finding they're not concentrating, then maybe the best thing is just to push the books aside and just talk to them. And that's part of the great program that Anne and her department has developed, is that it's about conversation. And that's also such a big part of them learning the language. Fatigue, sadness, anxiety, and then there's a whole slew of like physical symptoms, headaches, abdominal pain, dizziness. All of those things can also be a sign that they're having some depression or anxiety. So any questions about the mental health? I don't want to zip through that if you didn't get enough information.
So if we see that a student appears to be struggling with quite a bit of anxiety or sadness, they're crying. I mean, certainly bearing witness, like Anne said, being a listening ear, but should we bring it to Anne's or Claire's or your attention?
I think and Anne can also pipe in, but I think what maybe would be an appropriate route is maybe asking your student, would you be comfortable if I helped connect you with somebody that might be able to walk you through this? And if that's something that the student is willing to do, then by all means, you can even give my information out and I can find where the best spot is, or you can tell Anne or Claire and they can maybe have a conversation with the student and see.
Um,
Yeah, and that is terrific. I just didn't even know that was available. I was too new.
another thing that we've done, because, you know, then you get into those cultural issues with mental health, especially. I mean, it's worse in many ways than it is here, and we still have a stigma in mental health that we're trying to change that. We've had this happen where a student's son really had some problems, and we asked if maybe he wanted to talk to, and she wanted to talk to the imam of the mosque. So sometimes it might be better to go that route, because the imam was able to get him to see that maybe he needed some mental health counseling and some help with medication and stuff. So coming from a spiritual leader sometimes can be really helpful. So is there a church they go to? Do they go to the mosque? You know, that sort of thing is a good way to sort of bridge the cultural part of this.
Yeah.
So
I like that. That's really good. That's very true.
Thank you.
Do you feel like that's enough, Elizabeth? I know that that was something. Yeah. Okay. And even if you, after this, Elizabeth, if you feel like you want to chat some more about that issue, I'm happy to chat even just on the phone or whatever, because I'm sure it's, you know, I would imagine just kind of a helpless feeling to have someone be that vulnerable. And even if it's somebody that you don't know really well, what to do. So, yep, I know that the CMC wants to support tutors as however we can. So. All right, we're gonna just touch a little bit on women's health, and after that, we're gonna talk about where to go, resources in the community, and then we'll be probably close to getting to the point where we can just chat and see what questions you have. So, women's health, it's also something that many of the new refugees struggle with. It's such a culture shock coming here, our healthcare system in general, but also for women to fit into the whole OB system is a bit different from what they've done in their own country. And a woman that we had that came pregnant last year was just terrified of going to the hospital for when it was time for her to deliver, and realizing that that's a very real thing. Developing a program to where they can have not only the education for it, but also that similar to the prenatal classes that are offered, that we can have space to take them there. They can see what the rooms are going to be like. They can see the nurses, they can see the nursery, those things, so that it's not something foreign to them, but that they can plug in and go see. That is something that hopefully I'll be working on this year, just to eliminate that as a barrier, just their fear. And then also, like we talked about, women would prefer to have a female provider. And whenever that's possible, and if this is something that you feel like you can communicate, if that ever comes up in conversation, that they can absolutely ask for that. They don't have to assume that just because they were given a male provider that they can't have a female provider if one's available. So that's their right to ask for that. And then just those regular checkups that we as women need to have, something that we want to try and normalize, the prevention piece, since that can be so valuable in catching cancers and even catching pregnancies early if they're having those regular appointments as women. Talked a little bit about culture shock with the Muslim woman, that understanding cervical cancer that can be prevented would be great information to pass on to students. And kind of, we already talked about that. You can have a female provider if you want to. So, and you feel like in some of your classes that we could maybe even develop little, I don't know.
I just put a note saying I have a note of things to talk to Bonnie about. One of them is women's health classes.
Okay.
So I think because I've had so many tutors, and, you know, we've had female tutors who have taken it upon themselves to fully explain, get out diagrams fully explain the female reproductive system, explain how babies are made.
Yeah.
One woman genuinely didn't realize how babies were. I mean, she kind of understood, but not really. She kept getting pregnant. So, you know, that was really helpful. And how to prevent pregnancy. Sometimes that's,
Mhm.
this woman particularly had huge health issues, and they kept telling her, don't have another baby, and she kept getting pregnant and didn't know how to prevent it. So things like that. I mean, yeah, we've had tutors who are just like, oh no, this needs to be, but I think there's a place for some women's health classes particularly.
Good.
So, yeah.
I would love that. That would be great. And then just a brief mention of what they can qualify for if they don't get insurance through their employment. Many of these individuals will qualify for Medicaid. And that definitely is something that we can help, that staff can help at Catherine McAuley. So a referral back to us would be absolutely okay. So we can help get them on Medicaid so they're not worried about the money, so they can get the healthcare that they need. And then Mercy University and St. Luke's all have financial assistance programs, which are also probably a little bit overwhelming since the application is all in English, but we're happy to help people fill out those applications. So if you come across somebody that has huge medical bills and that's a stressor for them, just say, oh, guess what? We can have you go hang out with Abby for a while, or Bonnie, or they'll help you we'll walk you through that. And then it's always a good idea, even at primary doctor's offices, to ask about financial assistance, because that can happen. So this next slide, I'm going to actually pop to the, oh, I did put it in here. Okay, if you can go to the next one, it's kind of blurry, or I did share it with you. Oh, that's not too bad. Awesome. So these are some flyers that I have in actually Arabic, French, Spanish, and Swahili that I would love to get into the hands of the tutors as well, just to reiterate when it's appropriate to go where, and even explaining the different types of care that's available, the primary care, the urgent care, and the emergency care. On the previous slide, urgent care is not always the greatest option. It can be pretty expensive, and I don't believe necessarily, I don't know for sure, but if they have that financial assistance at urgent cares, I'm not sure. So being able to get that flyer into the hands of people that really don't know would be, I think, a great tool for people. So something too, that if we do any kind of classes that we open up to the public, if we do one on healthcare, I'd love to just see this everywhere so people get a good understanding of that. And a real push for primary care. I think we know this, but if you have a primary doctor that knows you and knows your health issues, knows your medications, and then you do get sick and are in the hospital, I mean, he or she can streamline that information to the providers at the hospital so that things can happen quicker. And so really good tool to push them to maybe establish those primary cares. If none of these options are available and your students don't have any kind of assistance with their healthcare, there are a lot of clinics that they can be referred to. There's a free clinic called His Hands Free Clinic. They not only offer medical, but they do chiropractic, which is pretty amazing that that's at a free clinic. They do have some mental health, and then they do have prescription assistance. So if they're needing medications, that is appointments are preferred, but walk-ins are welcome. They have particular hours, so I should probably come up with another flyer that we can have available that lists the connections in the community, so that if you come across somebody that needs some help, that
Is His Hands just still right down by us?
yes.
Or have they moved? Okay,
No.
because that's literally on the same block as
Yeah.
as us. So
Yeah, you can walk them, point out right out the door, and send them over there.
Yep.
And then some other clinics. There's also the Community Health Free Clinic, and they do dental, vision, and prescription services. And I'm pretty sure that one's by appointment only. And then in Iowa City, there is there's a free clinic there. Some of the same assistance. Urgent care is listed there for you in Cedar Rapids and Iowa City. And then here's the urgent care clinics if you need those as well. So just kind of wrapping up here, just some reminders that you can use if you need them. The whole thing that we've kind of talked about the whole time is just prevention, that making that in your conversations that it's normal. Prevention is normal, and it's even maybe just defining the word prevention for some of these individuals would be very valuable. Like, you don't want, even though you don't feel a certain way right now, if we can catch it early, it's going to save you in the long run. And taking that even a step further, since so many of these individuals value their jobs and not wanting to miss appointments. If somebody gets sick, really sick, then they can't go to their job. And if you can't go to your job, you're not going to have money. And if you don't have money, you're going to have all sorts of other issues. So seeing good health as kind of the foundation for keeping a good job and being able to do that. Remember that health perception varies largely by culture. And then also just be reminded that you're a tutor, that you're not a health professional. So not to feel like you have to carry the weight of solving all their problems, but knowing that, like we've talked about, you can pass that on. And I love this last one, is that it is actually every patient's right that speaks another language to have an interpreter, and that when they go to their appointments, that they absolutely can ask and should ask, and also should be provided with interpretation. Anyone that doesn't have English as a primary language, as a health professional, we are supposed to offer interpretation. And if that's not happening, then that needs to probably be brought to somebody's attention. So if you come across that, you let me know. I'm happy to make some phone calls and say, yes.
So the responsibility for having the interpreter at their medical appointment, is that on the clinic, or is Catherine McAuley providing that?
Nope, it's on the clinic. Legally, every doctor's office, hospital, urgent care.
I didn't realize that.
Yep, they're supposed to have a method of interpretation. Before COVID, a lot of them would call interpreters from His Hands or Humble, but also have used phone interpreters, or we have I work in the hospital, and we have it's like an iPad, we call it a Stratus, and we do video interpretation. And so we'll call and have kind of like a Zoom interpreter in the room with them. But yep, it's absolutely the responsibility of the healthcare organization to provide that.
I don't think it would hurt if they're making appointments to say that they need an interpreter, just because then you have it then it's, ahead of time for sure.
Yeah.
But I think this is really just about, like, we aren't providing the interpreters, but we need to know if that isn't happening, because we can provide the advocacy to get that. So, yeah.
Definitely. Well, any questions about anything so far, or anything else you're feeling like we missed?
This is so helpful, and I wished I'd had it 3 days ago. But that's all right. I'm learning.
Good. I was just going to end by talking a little bit about 2020, and maybe just to encourage you that you just don't know when you're going to have an opportunity to not only help the students with their language, but also just help them with life and strengthen them for the journey that's probably already been pretty hard, but sometimes probably still ahead for a lot of them. With the pandemic, Catherine McAuley had no idea what we were up against when it all started, as did all of our society. But some of the things that we found opportunities in the middle of that is we wanted to get information out as soon as possible, and had the opportunity to support the ethnic or the limited English population with accurate information about the pandemic. We also had a great food delivery system that we developed. It took a while. Katie Spleen, one of our staff members, also was able to not just get food donated, but also food that was more culturally appealing to some of those individuals, to the point where they could even, there was like a little checklist where they could circle or tell people what they wanted. So they could just call and say, hey, we need some food. And we'd say, all right, do you want this kind of flour or that kind of flour? And do you want peanut butter? Oh, you don't want peanut butter? Weird. No.
Weird.
Just the things that,
Right.
yeah, that would also help them. And so with those food, we would and deliver them, we'd put them on their doorsteps. But we started putting little flyers in there that talked about the coronavirus, and it was in their own language. And then also we started putting masks in there and hand sanitizers and bacterial wipes. And so a lot of our work, I would say, in the spring and early summer was about doing that, and then just making phone calls and calling and checking with them to see if they missed doctor's appointments or if they got their medications refilled. So a lot of that. And then, Anne, I'm sure you can talk a bit about your students and some of the work that you did with your students.
Well, it's a lot kind of along the same lines, because we're all kind of helping students and clients and everybody we can. So we did some videos for students in different languages talking about COVID, talking about ways that they can be safe with it. Certainly any student we talked to who needed resource navigation, we were helping. Getting the word out about the food was a really big deal. So it's, for us, it was sort of like as it came up, I know at one point we called all 485 students with different languages that they needed based on our staff, and just asked them how they were doing, honestly. And almost to a student, they asked how we were doing. I mean, it was so wonderful. They wanted to make sure CMC was all right and their tutors were okay. So that was pretty great. But we did that in that way. We identified some issues that people had, and they're much the same issues that everybody had. So
and now you can move on to the vaccine explanation. That was one of the last things that my student asked me. She says, "Are you going to get the vaccine?" I said, "Yes." "Well, I'll get it if you'll get it."
Good for you.
That's a good point, Judy. I don't know why I missed that. That you're exactly right. We need to get some vaccine information out. Another thing to talk about, Anna.
Yeah, I'm actually on a call today at noon with a group in Des Moines that is developing some bilingual information. So we're on it, we're meeting. So that'll be in your hands as soon as we have some of that too. Oh. That's just basically, this is what it is. This is why it's safe. This is why it's important. Yeah, I like that, Judy. If you get it, I'll get it. That's good. Very good. And then to Rachel, kind of a lot of the same information or the same things that we started to provide, just information, where to go, how to help, food, a lot of food assistance during to Rachel as well. And then I don't know if the two of you are aware, but Catherine McAuley recognized the need for shelter, that a lot of our refugees and immigrants, their apartments were completely destroyed. And so we were able to open our old building as a shelter for these individuals. And that opportunity was so great. Our refugee and immigrant staff, because our new building had a lot of work and we couldn't be there, we actually worked at the shelter doing our normal jobs. And being shoulder to shoulder with all of those beautiful people was so refreshing. Most of the time was so refreshing because we hadn't seen them for so long in person. And so just to have that face-to-face interaction with them and establishing, we had to, we are still in a pandemic, we probably should take care of that too. So had to establish our own processes there of how to keep everybody safe and keep them healthy when they're in a small space together. And thankfully nobody, they stayed safe. We even had like if somebody does come down with COVID, this is what we're going to do plan, just in case. But it was just a great experience. And I loved how even being there and being around them also afforded some health opportunities. And we found individuals in our community that we never would have met that had health needs. And so being able to now be a part of all this large group of people's lives to do that. And we're going on and doing, we have some disaster management now, some disaster case management that we are following through and checking up with individuals in our community that are still kind of reeling from the derecho, and making sure that they were able to file for the appropriate resources that they could with FEMA. And there's many opportunities that they had to be financially reimbursed for the damage that happened. And
I think it's also important to note that the majority of people at that shelter were people that were new to us. Mm-hmm. So this was, we did have a few students, a few clients that we already knew, but it speaks to our community at CMC that many people, and I wrote this to you, to the tutors, when this all happened, the students didn't, they knew they could talk to their tutors, they knew some resources, and the same thing I think with the clients for refugee and immigrant services, they had a community outside of their own country communities that they knew how to access. So I think and Bonnie just said, it's a new group of people that we got to meet. These were not people who were previously connected to CMC. So our connection to them, to our students and clients, made a huge difference in how they responded to the total disaster of the derecho. And that, like, I can't even express to you how amazing I think that is. And that has a lot to do with the tutors, with you guys. So yeah, we know it works. Unfortunately, we had to have a derecho to really see how it works, but we know it works, right? I mean, it's amazing. It's amazing.
And I love that you said that, because there's something that should not be overlooked about the one-on-one connection that you're having with these individuals, and not to feel like that's a small connection. The reason that it's huge is because there's so many of you, and you have such a desire to make a difference in this one or two or three person's lives, and to feel really, really good about that. And also know that those connections hopefully are with the perfect student teacher combination, and if it isn't, I think you can probably say something, right, if it's not working.
Absolutely.
That is so valuable to them and so important, and so not to take it lightly. And I know our organization does not, and we recognize we would be nowhere without our volunteers. So thank you for doing that, and know that what you're doing is so incredibly valuable. So there you go. I wasn't going to cry, but
right. You start to think about it, and then you're like, I'm a little weepy right now.
I know.
Yeah. I was actually just checking to see if we had another slide, and we do. So I'm gonna.
So just to end with this, because I'm just passionate about health and wanting to help people and help individuals be successful. So this is a quote by Nadine Garcia. She's actually the former Deputy Assistant for Minority Health, Secretary for Minority Health. That's a long acronym right there. Or it would make a long one. I can't even say it, but anyways, she said that many Americans struggle to achieve good health because of the healthcare and services that are available to them do not adequately address their needs. As our nation becomes increasingly diverse, improving cultural and linguistic competency across public health and our healthcare system can be one of the most powerful levers for advancing health equity. Basically, a fancy way to say that our country is going to most likely increase in its diversity, and that we need to realize that if we can help people understand our system and be more successful, then health equity is going to improve, which I believe we all would want to see people live longer and healthier lives. So if you have any questions, there's my information, and you can always get it from Anne or anybody at the center. This is my most amazing, beautiful daughter. Her name's Micah. I always end my presentations with her. I'm so proud of her. She moved to Mexico, and she's been there for 4 years. She speaks Spanish, and this is a beautiful little Mexican child. She's so in love with the kids down there, but she is part of an organization that does house building similar to Habitat for Humanity. And so they screen families, and they go in and build homes for them and take care of them. So